Fibula is the long bone of the leg that is homologous with ulna of the forearm. So this is fibula you have seen. Okay. So in Latin, the term fibula means pin. Hence, the lateral bone of leg is rightly named fibula because it is a long pin-like bone, and it is a long, slender postaxial bone of the leg and does not take part in transmission of the body weight. It serves two important functions. These are the two functions. Provides attachment to the muscles, and its lower end along with the lower end of tibia forms a socket that is known as tibiofibular mortise. You have seen in ankle joint tibiofibular mortise to hold the talus in place. Okay. See here, this is the tibia medial bone, fibula lying laterally connected with each other via this interosseous membrane, which is attached over the interosseous border of the tibia and fibula, and two gaps at the upper end and lower end. Okay, so this is proximal end where head and neck is lying, and this is distal end where lateral malleolus is lying of fibula. Here also you can see the proximal tibiofibular articulation. Over the head there is a circular facet which articulates with the lateral condyle of tibia to form the proximal tibiofibular joint. Middle tibiofibular joint is syndesmosis formed by this interosseous membrane, and distal tibiofibular joint is also a syndesmosis formed by inferior tibiofibular ligament. Okay, understood, connecting the two tibia and fibula. So, what are the presenting parts of fibula? Fibula is a long bone and consists of these three parts: upper end, lower end, and intervening shaft. Upper end or head is round and presents a circular articular facet. See here, this is upper end or head of the fibula. Here is a circular articular facet which articulates with the tibia, and upward projection posterolateral to this facet is called styloid process. This upward projection lying posterolateral to this facet is known as styloid process of the fibula. Uh, the shaft is described to have three borders and three surfaces are there: anterior border, interosseous border, and posterior border. And three surfaces are medial, lateral, and posterior surfaces. Okay. However, only interosseous border is clear cut, and other borders and surface is spiral, so that it is difficult to ascertain the borders, and none of them remains in position implied by their name. Okay, there is spiral uh, position, spiraling of the borders is occurring, that's why they are not lying in position. And the lower end is flattened and bears a triangular articular facet on its medial surface for articulation with the talus. Here, this triangular facet articulates with the talus, and behind and below it is a roughened fossa called malleolar fossa. This is the malleolar fossa. Okay, so you have to in the lower end you have to keep this malleolar fossa behind and below this articular facet. That's how you determine the site. So what is, how will you hold it in anatomical position? Place your thumb and index finger over this malleolar fossa and hold it like that. The head is above, malleolar fossa is below and behind the articular triangular articular facet. So, so this is fibula of right side, and hold it with the same hand to which side it belongs. Okay, so this is fibula of right side. So these are important presenting parts of fibula. Head of fibula, here is the head. It is a small knob-like extension from the proximal end of fibula, and that articulates with the lateral condyle of the tibia. Head is an attachment site for the soleus, biceps femoris, fibularis longus, that is peroneus longus, and extends the digitorum longus muscles, and the fibular or lateral collateral ligament. Okay, so all these structures are attached over the head of the fibula. Next we go to shaft of fibula or body. It is the elongated mid section of the bone. This lengthier part, this part is known as shaft of fibula. Next is interosseous border. This sharp border you can see, this sharp border is the interosseous border. It is connected with the interosseous border of tibia via the interosseous membrane. See here, interosseous border or margin is sharp edge medial margin of fibula, and that serves as the attachment site for the interosseous membrane which binds the fibula to the tibia. Next is lateral malleolus. Here is the lateral malleolus. It is pyramidal shaped downward projection from the distal end of the fibula. The medial malleolus, which extends more inferiorly than the lateral malleolus, articulates with the tibia and the talus bones of the foot to form the lateral portion of the ankle joint. And several ligaments attach the lateral malleolus to the tibia, talus, and calcaneum. You have seen in the ankle joint and joints of foot class all these ligaments which are connecting the lateral malleolus to the tibia, calcaneum, and the talus. Okay, so now at the upper end, here is the upper end, it presents head and neck. This broad part is the head, and the constriction just below the head is known as the neck of the fibula. Head is round and presents these following three features. Has a oval or circular articular facet on its superior aspect here. So over the head there is a oval or circular articular facet on its superior aspect for articulation with the lateral condyle of the tibia. Here is the circular facet and a styloid process posterolateral to the articular facet. This upward projecting part is the styloid process, okay, posterolateral to the articular facet, and which provides attachment to the fibular collateral ligament. Okay, and a sloping surface in front of the styloid process for C-shaped insertion of biceps femoris. Okay, over the head there is C-shaped insertion of biceps femoris muscle. You have seen biceps femoris muscle? Dissection দেখেছিস? No, not hamstring. Biceps femoris কোথায় ছিল? আচ্ছা ঠিক আছে, বাড়ি গিয়ে দেখে নিবি। ওকে, biceps femoris. Next is neck. Neck, it is a constriction below the head and connecting it with the shaft. This part is neck. The common peroneal nerve is related to the posterolateral aspect of the neck. This relation is important. Posterolateral aspect of the neck of fibula is related to common peroneal nerve, and here it is dividing into superficial and deep peroneal nerves. Okay. And anterior tibial artery on its medial aspect, anterior tibial artery. So in case of fracture, there is near the neck of fibula, there is high chance of injury to these structures. This common peroneal nerve will be involved, and also anterior tibial artery is involved. Next we go to the shaft. Shaft presents three borders: anterior border, posterior border, and medial border, and three surfaces are medial, lateral, and posterior surface. Anterior border, it provides attachment to anterior intermuscular septum. Here this is a cross section through the fibula. See here, this is anterior border, this is posterior border, and here is the medial border or interosseous border. Here interosseous membrane is attached. Anterior border है anterior intermuscular septum, posterior border posterior intermuscular septum. And here this and dividing into three surfaces. So this is medial surface in between the medial or interosseous border and anterior border. Between anterior and posterior border, that is lateral surface, and in between the medial border and posterior border, here lies the posterior surface. And this posterior surface is divided by a crest. This crest is very much prominent. Sometimes you confuse this crest with this interosseous border. Okay. So this crest is dividing the posterior surface into two parts, medial part and lateral part. There are different muscle attachment in this medial and lateral parts. That's why it is important. And this interosseous and anterior border, they are very nearer to each other. At some places there is only distance is only 3 millimeter like this. Okay. So here this will be the anatomical position. So this border you can see, this is anterior border. Okay. Beside this sub border is the interosseous border. Okay. And here this one is the posterior border, and this prominent part is the medial crest. Okay, which is dividing the posterior border into two parts, medial and lateral part. So in between the anterior border and interosseous border, there will be anterior surface. In between the anterior border and posterior border, here is the lateral surface, and in between the interosseous and the posterior border, whole of the portion is the posterior surface, and divided by this median crest into medial and lateral surface. Okay, so we will discuss this. So anterior border provides attachment to the anterior intermuscular septum of the leg in its upper 3/4, and it begins just below the anterior aspect of the head. Here it is beginning just below the anterior surface of the head. Inferiorly it splits to enclose a triangular area which continues on the lateral surface of lateral malleolus. Okay. See here, this anterior border here at the lower end, it splits to enclose this triangular area which is lying on the lateral surface of the lateral malleolus. Okay. And superior extensor retinaculum is attached to the anterior margin of the triangular area. Here is the anterior margin. So superior extensor retinaculum will be attached here, and superior peroneal retinaculum along this posterior border of this triangular area. Okay. Peroneus muscles are lying over the lateral surfaces. So here will be the peroneal retinaculum. Okay. And superior peroneal retinaculum to the posterior margin of the triangular area. Next we go to posterior border. It extends from the posterior aspect of the head, from the posterior aspect of the head to the lateral margin of groove on the posterior surface of lateral malleolus. Here, lateral margin of this groove on the posterior surface of the lateral malleolus. Okay, so here is the extension of posterior border. And posterior intermuscular septum of leg is attached to its upper 3/4. This is the attachment. Next we go to the interosseous or medial border. Here, just beside this anterior border, this sharp border is the interosseous border. So it lies close and just medial to the anterior border, separated from it only by 3 millimeter in its upper part. Okay. Inferiorly, it ends at the upper end of the roughened area for interosseous ligament. Here is the rough area for interosseous ligament, which was forming the inferior tibiofibular joint. Okay. Inferiorly ends at the upper end of roughened area for interosseous ligament, and the interosseous membrane is attached along its whole length except at the upper end to leave a gap for the passage of anterior tibial vessels. Okay, so these are the three borders and their attachments we have discussed. Okay. These are the attachment of different muscles over the surfaces. Schematic representation of the surfaces. See here, this is medial surface. Okay. So medial surface provides attachment to extensor digitorum longus, extensor hallucis longus and peroneus tertius. Extensor digitorum longus is attached in the whole portion of upper 1/4 and anterior portion of the middle 2/4, and posterior portion of the middle 2/4 gives attachment to extensor hallucis longus. All these are origins. And peroneus tarsius in the lower 1/4. Okay, so this is muscle attachment of medial surface. Next we go to lateral surface. Hairs in the upper 2/3 peroneus longus, lower 2/3 peroneus brevis. Okay, and peroneus longus lies superficial to the peroneus brevis. In the anterior half, in the middle third, there is peroneus brevis, and posterior half in the middle third is peroneus longus. Okay, and here whole portion is for peroneus longus, the lower part whole portion is for peroneus brevis. Next we go to the posterior surface. Here is the posterior surface. Okay, it is divided by the median crest into medial surface and lateral surface. In the medial surface, there is attachment of origin of the tibialis posterior in the upper 2/3 of grooved surface between medial crest and medial border. And here in the lateral part, there is origin of upper 1/4 to the gives attachment to soleus and lower 3/4 flexor hallucis longus. Okay, so this is flexor surface mainly. This is a peroneal surface or lateral surface, and this is extensor surface. Okay, so here flexor muscles are originating, here peroneal or lateral compartment muscles are originating, here extensor muscles are originating. Okay, understood? So that's how you remember it. This is schematic diagram of tibia and fibula. Here is the attachments. Soleus posterior surface is seen viewing from the back. Okay, this is attachment of soleus. This is tibialis posterior, medial to the medial crest, and here is the flexor hallucis longus. Here is peroneus brevis. Okay, and this is anterior viewing from the front. You can see this is on the lateral aspect, upper part peroneus longus, lower part peroneus brevis, and here you can see the extensor digitorum longus, extensor hallucis longus, peroneus tarsius. Okay, these are the muscle attachments. And see, here is the relations of the neck. Laterally, posterolaterally, it is related to common peroneal nerve, which is dividing into superficial and deep peroneal nerves, and medial to the neck lies this anterior tibial artery. Okay, these are important structure related to the neck. And here, over the head, this is styloid process. Tip of styloid process gives attachment to the fibular collateral ligament, and this is C-shaped insertion of the biceps femoris. This is important. Okay, biceps femoris is important muscle. Okay, and at the lower end there is attachment of capsular ligament of the ankle joint. Okay, understood? And over the interosseous border, attachment of this interosseous membrane, and gap at the upper end has been shown. So this is how it is connected. Tibia, this is section of tibia, this is fibula. Interosseous border of these two bones are connected via the interosseous membrane. Anterior border, posterior border, and this is interosseous or medial border, and this is medial crest, dividing it into medial and lateral surface part of the posterior surface, lateral surface, anterior surface. Okay. Next we go to the surfaces, medial or extensor surface. It is narrow. This is the attachment of medial surface we have discussed. Medial or extensor surface, it is narrow and lies between the anterior and interosseous border. Gives origin to extensor digitorum longus in the upper 3/4, whole width of its upper 1/4 and anterior half of its middle 2/4. And extensor hallucis longus arises from posterior half of the middle 2/4. Here extensor hallucis longus, medial to the extensor digitorum longus, and the lower 1/4 provides origin to peroneus tarsius. Here is the peroneus tarsius. Next we go to the lateral or peroneal surface. Here is the lateral or peroneal surface, lies between the anterior and posterior border. Peroneus longus arises from upper 2/3, whole width of upper 1/3 and posterior half of middle 1/3, and peroneus brevis arises from the anterior half of its middle 1/3 and whole width of lower 1/3. Okay, so peroneus longus, peroneus brevis. Next we go to posterior or flexor surface. Here it is extensive and lies between the interosseous and posterior border. Its upper two-third is divided into medial concave and flattened lateral part by subvertical ridge that is known as medial crest. Here is the medial crest. And fascia covering the tibialis posterior is attached to the medial crest, and the medial concave part gives origin to tibialis posterior. Here this medial concave part gives origin to tibialis posterior, and lateral flattened part gives origin to soleus in the upper 1/4. Here is the soleus, and to the flexor hallucis longus in lower 3/4. Flexor hallucis longus in lower 3/4. Peroneal artery descends along this medial crest, and nutrient artery of the fibula, that is a branch of peroneal artery, enters the nutrient foramen present just above the middle of the posterior surface, and nutrient canal is directed downward. Okay, so growing end will be upper end of the fibula. Nutrient artery goes away from the growing end. Okay. Next we go to the lower end of fibula. Lower end of fibula is expanded antero-posteriorly. Here this is lower end of fibula expanded antero-posteriorly to form the lateral malleolus. This projecting part is lateral malleolus, which presents four surfaces: anterior, posterior, medial and lateral. Here is anterior, this is posterior, here is a groove. Lateral, lateral is smooth almost, and medial. Medially there is a rough area for articulation with tibia, a facet for articulation with talus, and a malleolar fossa. Okay, posterior inferior to the triangular facet. Okay, so lower end of fibula is expanded antero-posteriorly to form the lateral malleolus, which presents four surfaces: anterior, posterior, medial and lateral. Anterior surface is rough and round. Here anterior surface rough and round provides attachment to the anterior talofibular ligament, and a notch at its lower border provides attachment to the calcaneofibular ligament. Ligaments you have seen in ankle joint class. And posterior surface presents a groove which lodges the tendon of peroneus brevis and longus. Here this groove on the posterior surface lodges the tendon of peroneus longus and brevis. Longus lies superficial and brevis lies deep. Okay, and the latter being superficial to the former. Medial surface presents a triangular articular surface in front and a depression or malleolar fossa below and behind it. This relation is important. Triangular articular facet in front, and below and behind there is a malleolar fossa. Okay. And the upper part of malleolar fossa provides attachment to posterior tibiofibular ligament and its lower part to the posterior talofibular ligament. And lateral surface is triangular and subcutaneous. Here this triangular flattened area, which was the extension and which was formed due to splitting of the anterior border. This triangular flat area, this part is subcutaneous. You can palpate there in your foot. Okay, so this is so we have discussed upper end, shaft, its three borders, three surfaces, their attachments, and the lower end. Here is the attachment of lower end. See this triangular facet, this triangular rough area at the lower end. This gives attachment to interosseous ligament. Here is a triangular facet for articulation with talus, and these are the attachments. This is malleolar fossa. Upper part gives attachment to posterior tibiofibular ligament, lower part posterior talofibular ligament, and here calcaneofibular ligament. And here is attachment of anterior talofibular ligament. Okay, understood the attachments of lower end. Next we go to anatomical position and side determination. That is very, very important. Okay, the side of fibula can be determined by holding it vertically in such a way that its rounded end called head is directed upward. So head, this part is head, this rounded end will be above. So above and below is determined by head is upward. Then it is relatively flattened and is directed downward. This flattened end, or which is possessing the malleoli, that will be directed downward. And a triangular articular facet on its lower end faces medially. This triangular articular facet at lower end, it faces medially. So that's how determine medial and lateral. So above and below determine, medial and lateral is determined. Now we have to determine anterior and posterior. And a depression at the lower end, that is known as malleolar fossa, that lies below and behind the triangular facet at the lower end. See this depression, this is very prominent depression. This is lying below and behind this triangular articular facet. Okay. So if I hold it like this, all these point can fulfill. So this will be fibula of the right side. Okay. And here you can see this is fibula of the left side. Malleolar fossa is below and behind this triangular facet. So that will be the difference. And for both of the bones, you have to identify other presenting parts, border, surface, facet, styloid process, all you have to know. Okay, understood? So you will be able to hold it in anatomical position, hold it vertically, head will be above, malleoli will be below. Medial and lateral triangular articular facet for talus, that will be medially placed, and malleolar fossa will be below and behind the triangular facet. Okay, that's why anterior posterior determined. Understood? Next, after that, we go to the ossification of the fibula. Fibula ossifies from three centers, one primary center and two secondary centers. Primary center appears in the midline of the shaft at the age of 8th week of intrauterine life, and secondary center for the upper end appear at 3 to 4 years of age, and fusion with the shaft occurs at 20 years. Ossification is very important. Okay, there is important explain why question from this ossification. I will discuss that question. For the lower end, appearance is 1 to 2 years, fusion with the shaft at 18 years. Okay. What is the rule of ossification? The center which appears first, fused last. Okay. So here it is, this rule is not following. Okay. It is appearing first, so it should fused last, but here this is appearing last, also fusion is occurring last. That's why it is exception. So this comes very important, explain why question. Why there is law of union of epiphysis is not followed in fibula. The cause you have to know. In fibula, law of union of epiphysis is violated. According to the law of union, there is epiphyseal or secondary center which appears first, unites last with the diaphysis. But in fibula, epiphyseal center for the lower end appears first and also unites first. And the explanation to this violation is that epiphyseal center in the lower end of fibula appears earlier. Why it appears earlier? Because it is a pressure epiphysis. You have to carry the weight of whole the body via the tibiofibular mortis towards the foot. So it is a pressure epiphysis. That's why it appears earlier. And as the growing end of fibula is at the upper end, that's why the upper end fuse last, as evidenced by direction of nutrient foramen. It unites with the diaphysis last. Epiphyseal center also appears last. That's why there is violation of the rule. Understood? Due to pressure epiphysis, it is appearing first, and because of the direction of nutrient foramen or direction of the nutrient artery, upper end there is fusion is last, upper end is growing end. That's why there is violation. It's very important, explain why question very frequently comes. Okay. Next we go to bone graft. This is also comes why fibula is used in bone graft. Okay. So as the fibula does not take part in transmission of body weight, it is a common source of bone for grafting. Okay. In case of fracture, comminuted fracture, there is less chance of healing, then we do the bone grafts. Okay. Or in cancer patients also. Okay. In blood cancer, bone marrow grafting is done. Fibular fracture. Fibula is commonly fractured 2 to 5 centimeter proximal to the distal end of lateral malleolus and often associated with fracture dislocation of the ankle joint. Okay, so this is the common site of fibular fracture. So all these clinical aspects of fibula are important. Okay, that's all. Okay, so you will be able to hold it in anatomical position. Head is at the upper end, head or broad end. Below the head there is a neck and the end containing the lateral malleolus will be downward. Above and below determine medial and lateral triangular facet for the talus that will be directed medially. And anterior and posterior, this malleolar fossa will be placed below and behind the triangular facet. So that's how you hold it in anatomical position. You hold it vertically on the with the same hand to which side it belongs. So this is a fibula of right side and I am holding it with the right hand. Okay, so this will be the anatomical position of the fibula. And this circular fascia near the head, it articulates with the lateral condyle of tibia, forming the plain synovial type of proximal tibiofibular joint. And this is styloid process. Okay, gives attachment to lateral collateral ligaments, or fibular collateral ligament. And border surfaces are important. And from in front of the head, anterior border is starting. At the lower end, it diverges to enclose a triangular flat surface at the lower end, which is located on the lateral surface of the lateral malleolus. Just medial to the anterior border, here is the interosseous border, and the distance between the two borders is only 3 millimeter in the upper part. Interosseous border gives attachment to interosseous membrane, and posterior to the head, here starts the posterior border, and at the lower end it lies on the lateral margin of the groove for peroneal muscles. Okay, and three surfaces in between the anterior and interosseous border, here is the medial surface. In between the anterior posterior border, here is the lateral surface or peroneal surface. Anterior surface is the medial surface is the extensor surface. Our posterior surface is flexor surface. Okay, tibial is posterior and other flexor muscles are provides attachment here. Okay, understood, originating from this surface. And posterior surface is divided by the medial crest into medial concave area here and lateral flattened area. A nutrient foramen is located near the middle of the bone and it is directed downward. Understood? That's why this growing end is upper end of the fibula. Okay, and that explain why question you read carefully. So this will be the anatomical position of the fibula. Okay, understood? Superior, middle and inferior tibiofibular joints. Type of joints are important. Superior one, plain synovial. Middle one, interosseous, via the interosseous membrane, syndesmosis. Inferior one, also syndesmosis or fibrous type of joint formed by inferior tibiofibular ligament, interosseous ligament. Okay.